Good evening, everyone. This is Nicholas Sarwark, chairman of the Libertarian Party. This is our first LPTV town hall. In this era of social distancing, the Libertarian Party wanted to make sure that we're able to connect with our members, connect with our supporters around the country and around the world, and provide good information for you in a time when information has not been forthcoming from our elected officials from the two old parties. What we see right now in American politics is a lot of people trying to get political advantage or advance their goals in this time of crisis to, as Rahm Emanuel used to say, never let a crisis go to waste. And what we want to do as libertarians is recognize that we are in a battle with an infectious pandemic that's requiring us to change our lives, change how we interact with the world, and come together as people, not as libertarians versus Republicans and Democrats, not as Americans versus other countries in the world, but as humans versus a virus that has its only goal is to kill us, and it's our goal to defeat it together. So in this first town hall tonight, we're going to be focusing on healthcare issues around the pandemic, how you can help, how you can respond, and provide good information from libertarian experts and elected officials around the country that you can use and go out into your community and be that example of what a libertarian is. This is not about us getting our policies put into place for political advantage. This is about us showing how freedom and many hands deciding different ways to do decentralized solutions in a crisis can actually benefit our communities and save lives. So our first guest tonight is Dr. Peter Everett. Dr. Everett is cancer doctor, an oncologist at Boston Medical Center, and joins me from just outside of Boston. Welcome, Peter.
Hi, Nick. Can you hear me?
I can hear you great.
Okay. So I just want to preface my remarks by saying that I practice medical oncology and internal medicine. Infectious disease is not my subspecialty, so my knowledge of the coronavirus is of a general medical doctor level. Nevertheless, I've been following this very closely, and needless to say, these are my views and not the views of Boston Medical Center, Boston University, where I'm on faculty.
With that disclaimer, can you tell our viewers what we know in basic terms about the novel coronavirus, how it spreads, how it's different from some other diseases that they've heard of? I know this is a type of SARS, and so there's this question of, is this like the SARS that we heard about 10 years ago? And what they need to know about how it spreads and how they can take good steps for themselves.
Yeah. So this virus, which is technically called SARS-CoV-2, is extremely closely related to the SARS virus of 2003. And what makes it worse than the SARS virus of 2003 is that it is much less deadly and much more contagious. And now you may think, well, wait a minute, how can that, if it's less deadly, how can it be worse? And the answer is that by not making you too sick too fast, you can go around and you can go to the gym in the Senate, or you can go to the supermarket, you can go to spring break and you don't feel bad, but you've just given the virus to dozens of other people who give it to dozens more, and it spreads very, very rapidly, and only about 10% get super sick later on, and then a few percent, or maybe a fraction of a percent, actually die despite the best medical efforts that we have available today. So it's a very sneaky virus. It is a very dangerous virus, and it is in most places in the world where it has appeared, its doubling rate for both infections and death is about every 2.5 days.
Can you go a little bit into what that means, this idea of a doubling rate? Because a lot of people have been pointing out on the internet and on TV and even the president has said a month or so ago, there's only a few cases that we see. There's only 100 or 20 cases. Why is that not actually a sign of safety, and what does this doubling rate look like?
Okay, so I'll bring us all back to high school when we were told the story of the modest farmer who did some great favor for the king. I think it was in India. I forget exactly how this story goes. And so the king said, "Oh, you've been great. I want to reward you. I'll give you anything you ask for." And the farmer said, "All I want is a grain of rice on the first square of the chessboard, and 2 grains of rice on the second square of the chessboard, and 4 on the third, and 8 on the fourth, and so forth until you've doubled it every time for all 64 squares of the chessboard." And the king says, "Oh, you're too modest. You're not asking for enough. I've got to give you more than that." And he says, "No, really, that's enough for me." And of course, once you do the math out, you find out that that's more rice than 1,000 planet Earths could ever produce. So that's the power of exponential growth. Yes, go ahead.
Go ahead.
Well, I have a chart of the COVID-19 deaths in various countries. Are you ready to see it?
Yeah, please.
Okay, so we're going to do the sharing screen thing, and we're going to find the window. Okay, mortality by country. All right, can everybody see that?
Yeah, we see it on our screen.
Okay, so the print is a little small, but this is what's called a semi-log graph, where the horizontal axis is days divided into 6 weeks. So the whole graph covers 6 weeks, and then the vertical axis is powers of 10. So at the bottom is 1, and then 10, then 100, then 1,000, then 10,000, then 100,000. And so on semi-log graphs, when a line is straight, that means that the rate of doubling is constant. It's not speeding up. It's not slowing down. It's just doubling relentlessly at a constant rate. I put a dashed blue line, which you can see stretching off to the upper right, which is the marker of a 2.5-day doubling rate. And you can see that the United States is right there hugging that line. The UK, the Netherlands, Germany, Switzerland, sadly, Spain is going a little bit worse. They're doubling a little bit faster than that line. Italy was doubling faster than that line, and they've started to bend away. Iran, it looks like, was a little slower. France was slightly slower, but basically across a wide variety of cultures and people and continents, what this virus does is it doubles every 2.5 days. And that's a frightening thing.
So with this doubling every 2.5 days, if nothing is done, if we just have the virus spreading at its normal rate, even though the United States just crossed 1,000 deaths, that means that by the end of next week, we would be crossing 10,000 deaths at least.
Yes.
And then
yes.
The week after that.
Now, there is one caveat. Obviously, there's only 300 and something million people in the country, so it can't go forever. And what ultimately, if we do absolutely nothing, what it ultimately does is it bends towards horizontal, because so many people have been infected and recovered that it can't find the virus can't find any uninfected people. But for as long as the total number of infected people is a minority of the total number of people, the curve just marches along straight up.
So I want to ask a question that I think a lot of people probably are wondering, which is, many of us have dealt with either voluntary suggestions, CDC advice, medical experts saying, wash your hands, maintain 6 feet of separation between people, don't go out to do things if you don't need to try and stop the spread of the virus. But if you look at your chart, which you got from publicly available data so everyone can check your work.
That's from the Johns Hopkins University data repository.
Right. So you have that chart and you see that the line is still straight. So even though we've been doing this stuff pretty intensely for about a week or a week and a half, there's not a movement in the number of deaths. And can you explain to people why is that? Why is it that we're not seeing results
Sure.
from all of these measures that a lot of people are going, who is the government to tell me, that I should even do this? Is this just something that they're making up? Why is it that we don't see the results?
So people who die from COVID-19, on average, contracted it about 2 weeks prior. So you're not going to see any movement in the death curve until the proper precautions, effective precautions, have been in place for at least 2 weeks. And that those precautions are the things that I think everyone has heard. You treat all surfaces as contaminated, wash your hands before and after touching anything, wipe down surfaces you're going to use, don't touch your face, and stay away from other people far enough that the aerosols from their breathing, which is not always visible, are unlikely to reach you.
So what we're seeing is that the virus starts a while back and it takes a while for people to be treated for the virus, and then people don't recover if they need hospitalization for 10 to 12 days. Is that right?
Yes, the hospitalizations tend to be fairly long, and that puts an additional burden on the hospitals because if people do need supplemental oxygen or worse, mechanical ventilation, they can be on the vent for a long time. The SARS experience of 2003 taught us that ventilators can be life-saving if used properly. The effect of SARS-type viruses or ARDS on the lungs requires a very delicate use of ventilators, and with regulating the pressure so that to minimize the damage on the lungs. But these can be long periods of intubation, and then to wean somebody off a ventilator who has been on it for a period of time when their muscles are not being used to breathe and they're not very strong can take a long time. So once someone is on a ventilator for a week, getting them off is a slow process. So
tell me if this analogy makes sense to you. This is kind of like if you take your car in to get an oil change, they put it on the rack, they take the oil out, they put the new oil in and the new filter, and then you're out of there in half an hour. That's, the convenience of the thing. But if you take your car in to have your engine rebuilt, it could be on the lift for a week, and there's not going to be space for another car to come in and be worked on in that time frame. So that's
right.
kind of what's happening to our hospital system, or given this time lag from when you get the virus to when the disease symptoms show up, that's what's gonna happen to the hospital system in a week or so from now.
Right. A lot of what's going to happen is already baked into the cake, and we have to just be prepared for the onslaught until the measures that we are all taking to stop the spread start to be felt.
Someone on the comments asked, what's the infection rate, the R0 for this virus versus the common flu that we deal with every year that kills lots of people, mostly elderly or people who are medically vulnerable? How much more or less infectious is coronavirus?
So COVID-19 is definitely more infectious than the flu. People who, if you give me the flu, I'm having symptoms within 1 to 3 days, and I'm kind of out of action for a while and not spreading it to a lot of other people. So someone with the flu gives it to between 1 and 2 other people on average. The R0 numbers are very variable depending on the particular flus. And, so for example, H1N1, we all remember from 2009, was a little bit worse than average. It depends on what kind of herd immunity the virus runs into in the community. There is no herd immunity to speak of with the COVID-19 virus. So it has free run. It can get anyone it wants. And so we think that the R0 for COVID-19 is sort of in the 2.5 to 3 range.
And it's what they've found is that as opposed to the last SARS, the viral load and the infectious capability of a person who's infected is actually higher during the 4 to 5 days before symptoms show up than it is after they're very obviously sick and people are staying away.
Right. At a time when an influenza A patient would be home, with tea with honey, feeling sick, the COVID-19 patient is still going to work, still going to school, still going to spring break, still going to still volunteering at the senior center. And those are the scary things.
And so to be clear, for a lot of people who are under 60 years old and don't have other medical conditions, this is not likely to be deadly to them. It's possible, it's happened, but it's not likely.
It certainly has happened. Young people are dying, but it is very unlikely. Those are the exceptions. If you are under 50, your chances that this will kill you, if you don't have any underlying, you're a non-smoker, no lung disease, no diabetes, no high blood pressure, the odds that the virus will kill you are very low. But the odds that you could give it to someone who might be killed by it is not so low.
Okay, so it's more about what we're doing for other people by socially distancing, by washing our hands, by not getting into large groups. It's about other people, not so much about us.
Mostly. But that's what contagion is always about. It's always about other people.
Okay. At this point, I want to bring in Apollo Pazell. He is the vice mayor of Copperton, Utah. Hi, Apollo.
Hello, how are you?
Hi, Apollo.
Doing great. Apollo, tell us, what are you facing in Copperton, in your city, as an elected official in this kind of crisis? What experiences have you had, and what challenges are you facing there in Copperton?
Well, the most immediate challenge that we're seeing right now is the conflicting information that we are receiving from different levels of government. Just recently in Utah, in the Salt Lake County, where my community is the Salt Lake County mayor issued a ban of gatherings of 10 or more people, as well as shelter-in-place orders that quickly were repealed by the governor, who came in and said that those orders were not necessary. So conflicting orders from state and county level officials who do not have the law enforcement capacity to enforce these orders, so in turn are pushing that onto the municipalities to enforce with their police services, to enforce things that are pulling our resources away from areas that it could be more effective. That's the most immediate effect that we're seeing.
And in Copperton, you guys are dealing with not just this public health crisis of having an infectious pandemic, but you recently had a pretty serious earthquake. Is that right?
We did. So on the first or the second day of the emergency declaration from the state of Utah, Copperton was about 2 miles away from the epicenter of a 5.7 earthquake. So we did have the additional challenges of dealing with multiple aftershocks. We have 100-year-old houses, so we did have chimneys toppling over, and a lot of safety concerns that required people to leave their isolation, to leave their the social distancing environments, so that they could go out and interact with inspectors, with contractors, with their neighbors. So yeah, we had a challenge early on in this. Yes.
So when you get this kind of conflicting information from the federal government, the state government, the county government, these sometimes policies that appear from what you're hearing from health experts to be counterproductive or contrary to public safety. As a Libertarian elected official, what's your response to that?
So we were with an older community. The information was dripping out, and all we were knowing was that people with immunocompromised individuals and older individuals were in higher targeted areas, which put our community into a panic. So when we have conflicting information, we have political pressure from our constituents, from our voters, to either put more draconian measures in place. There's suspicion in our communities, among neighbors, which again increases that political pressure to do that. And at the same time, we have the political pressure of people saying, this is just the flu. We need to free the economy. So trying to balance that has been a challenge. But what we have been able to do in our town is a very effective social distancing plan without any mandatory shutdowns. That's easier in our town than other places in the valley, but we haven't had to do any mandatory shutdowns of any businesses. We put out a warning and the advice from the CDC with our strong advisement that they cancel all events that day. Church services were canceled, Lions Club meetings were canceled. It was the voluntary community response that really made it so Copperton didn't have to do anything more aggressive, which was thankful for me as a libertarian. Yeah.
So when you gave people the accurate information about what the public health experts were saying, what the scientists and doctors were saying, and told them what the effect would be of changing their behavior, you observed that people did do the right thing without being told that they would be arrested or that there would be curfews or tickets given out to people who go to a place they're not allowed to go to. Is that what you saw? Because a lot of people are telling me that if we don't have a governor or a president telling everybody you can't go to a crowded area, you can't have a big event, you can't travel in certain places, you have to stay home, that people are going to be irresponsible. Is that what you've seen,
Yes.
Paulo?
Yes. So what we have seen is if you provide the information to consenting adults and explain to them what the seriousness of the situation is, and for them to make appropriate accommodations to be able to slow the spread and flatten the curve, they make that decision themselves to a large degree. As a matter of fact, our community, I imagine, is no more responsible or less responsible than any other part of the country. They would report to us and say, hey, we have suspicions that we have come in contact with somebody who might have been infected with COVID, and we would do with them, with cooperation with them, we would do mapping of the virus to see where there might also be infections or possible exposures, and it's resulted in as of now no positive test or no positive cases in Copperton. But what spawned us, and I know that Dr. Everett wants to join in here, but let me just say this. We did have one patient who was a transplant patient who was exhibiting symptoms of COVID and was turned away multiple times, even though our congressman received a test. So it prompted the Copperton Council to start exploring the reasons why, including FDA regulations and state regulations that are prohibiting testing to be done in a wide way. Copperton did pass a resolution asking the governor of the state of Utah to ignore FDA guidelines in order to allow a biomedical company in the state of Utah to try to produce and test individuals at a much wider margin.
Okay. Dr. Everett, did you have something on this?
Yes, I just want to speak to the idea that given the right information, people do the right things. And I serve on the board of a college in Boston. I am also a member of the martial arts group. I'm a member of the Massachusetts Libertarian Party. We all had events coming up. The college extended spring break and went to an online mode after that, cleared out the dorms, as did many of the other colleges in Boston, without being told, without anything being mandated. Our martial arts organizations were planning a tournament and a promotion event, and we stopped that because we knew it would be harmful to our members. The Massachusetts Libertarian Party went to an online mode for our convention. I think this was the first virtual cyberspace state convention in the history of the Libertarian Party, as far as I'm aware, and it worked out very well. I went to the store to buy beer, and the owner of the store was out front, or the manager, and people were lined up on the sidewalk. They were all about 8 feet apart from each other, or 10 feet apart from each other, and he was only allowing about 10 people in the store at once, and everyone was, social distancing, and there was no mandate for that. Everyone was just doing it because it was the right thing to do, and it was a spontaneous outpouring of caring for their fellow man that the people who were, buying beer that day did that. So people, given the right information, do the right things, almost completely.
Even today, Governor Cuomo is quoted as saying that he believes that mandating the shutting down of all businesses may not have been the best public health decision. And it's in the areas that there have been stricter shutdowns, you see more people pushing back.
Right. Have you seen that these public health orders you're seeing from governors in various states, from municipalities, are they describing things that people are not otherwise doing, or are they putting sort of an order out that matches the behavior people are already exhibiting after getting this information about the infection, how it spreads, and how they can keep themselves and others safe?
So what I have seen is, by and large, it's a lot of grandstanding from politicians who are up for re-election this year, trying to show that they are the strong leaders that their communities need. And in that rush, I see a lot of redundancy. I see people actively taking responsibility for themselves and their families, and the government coming in afterward and mandating it. There is one that is, I would say, reactive to an actual concern, and that was shutting down playgrounds. Which a government facility, a government public space, I can understand that shutting down the playground or shutting down a park, I'm fine with that. But the public health order came to our town that they would want to use our resources and further exacerbate our law enforcement officials to enforce this order. When the vast majority of people who would be receiving that Class B misdemeanor citations would be children or preteens who are breaking these playground orders. When I believe we could close the park, post it on the park, and people would be responsible and follow through the way that they have on everything else. I think this order is jumping the gun, so we will be pushing back on that county order as well.
Dr. Everett, on those orders where people say, you've seen beaches closed, you've seen parks closed, is it necessary to stop people from going outside and getting fresh air and sunshine? What's the actual health reason for the order, and what can people do, regardless of whether there's an order in their town, to stay healthy, keep pretty upbeat, and get some exercise while still being safe for themselves and others?
I'm not aware of any reason why outdoor spaces should be prohibited. People are pretty good. I went hiking with my daughter last weekend, and the hiking trails are very popular because, of course, all the students are home, and people were just spacing themselves out and avoiding each other on the trails, and there's no real reason not to go outside, provided people have the information they need to separate themselves.
Okay. Apollo, you were talking about the testing availability and, pushing back against, you're asking your governor to defy the FDA. Can you just, that doesn't sound like something a lot of people hear from an elected official, that you would want to break a law. Can you just help people understand why you think that was the right thing to do as an elected official there in Copperton?
I think in the face of something of this scope and this size, with the data that the lack of data that we're receiving, it's the responsible thing for us to do for the public's sake, for public health's sake, to defy orders that are actively harming our residents, actively harming our voters. There is no doubt in my mind that Utah will be behind the curve on this because we refuse to allow this biomedical company to release its tests, which are now in use. The FDA has now officially approved them, but wouldn't for weeks and weeks. And I'm convinced that Utah is behind the curve. We have Sundance every year. We have an active ski season from people all over the world. I am certain that we are behind the curve on this, and it is all because we were too afraid to defy the FDA, and that will lead to death. And I think that it is important for elected officials to do everything that they can to. The essential function of government is to really, in the argument could be made, the only function of government is to ensure that we can protect ourselves, that individuals can protect themselves in the best way that they see fit. And I think that was breached by the FDA's orders.
Dr. Everett, can you tell me, the FDA has come up a lot, and the FDA, we traditionally has been thought of, at least in America, as protecting public health and safety, that their goal is to make sure that unsafe drugs or medical devices don't get out to the public. And it's often an argument made against libertarians that you want to get rid of the FDA so that, we can have people selling poison. What do you see happening here with the FDA in this crisis, and why did it happen? Is there a reason why it happened?
So our regulatory structure is uniquely unsuited to respond to a crisis of this nature. What the FDA is good at, to the extent that they're good at anything, is preventing anyone from making money on something that doesn't work or is harmful. So the way you prevent anyone from making money on something that doesn't work or is harmful is you make it very expensive to get approved, and you make it a very slow process, and you require a lot of detailed and comprehensive testing. And if you're selling an acne cream or an antibiotic or even a cancer medicine, that is often a not terrible way to go. I have some issues in the cancer field, of course, with the slowness of the FDA, but the slowness is their methodology for protecting the public. And that is the exact opposite thing from what we need. And in the current pandemic, my opinion is that the FDA has caused more harm in this one pandemic than all the good they have ever done since the 1962 amendments to the FDA legislation that in the wake of thalidomide. That they have completely undone all of the good that they have ever done in their entire history in this crisis. And
I agree.
It's a sad thing to say.
And so what should elected officials, what should we as individuals do if we're faced with this idea that the government or the FDA is blocking testing, is blocking the release of tests that could provide valuable data about how many people are actually infected, how many people have recovered from the infection? I know that there was some controversy because the initial tests developed with the CDC were actually faulty, and that lost us weeks. So if an elected official is faced with knowing that there's a test available that could work and seems to be accurate, but the FDA isn't approving it, what do you think is the right thing to do, Dr. Everett? What is it that you think is the right thing to do? Apollo, we'll go to Dr. Everett first.
So my opinion is that if you see the path ahead of you for what the right thing is to do to save lives, you do it, and you let people sort things out afterwards. I was very upset with Governor Charlie Baker in Massachusetts. We were very lucky here in Boston. We have access to basically, we're one of the medical capitals of the world. We have, some of the best infectious disease specialists in the world. We have some of the best laboratory facilities in the world. And he could have said, I'm going to listen to the advice I'm getting from the experts, and I'm not going to wait for the FDA to say it's okay. I'm going to, tell the hospitals in my state to start testing people, and the laboratories in my state to start testing people. And if your doctors agree that the test is good enough for the use intended, then just do it. And I will have your back. The role of a governor in that situation is if the FDA bothers you, I have your back. It's on me. And that's what a leader would have done. Instead, he was quoted on TV as saying, "I'm not going to violate federal law." And that made me think back to 1854, when fugitive slaves were fleeing were in Massachusetts, where of course we are a hotbed of abolitionists, and the governor of Massachusetts at that time also did not have the back of the abolitionists and the slaves who were being protected by them, and wouldn't violate federal law and let the marshals come and take the fugitive slaves back to slavery. So that's not good company to be in for my governor, and I was very disappointed by that.
Yeah, from my perspective, and what we've been trying to do is we have reached out to the company who did produce or had the means to produce the 50,000 tests in Utah. We've also reached out to other locations. We were prepared to use a portion of our budget to buy our own testing, to contract with a private company to do our own testing, because we are convinced, my counsel and myself, we are convinced that the key to this is testing and mapping the spread of the disease. And if it becomes available, if there is a way for us to get access to those tests, we will buy it. We will defy state orders if we must. We will buy the tests when they become available, if it does not ramp up, which luckily in Utah we have seen an increase in testing, not nearly what it needs to be, but there has been an increase. And yes, actually, the Korean style tests, as a matter of fact, the first tests that they were using were made by a company in North Carolina. And we are not able to use, they were not FDA approved, even though they were made in the tests used in South Korea were being made in our country.
Yeah, I think, one of the things that has been so destructive in fighting this pandemic, a lot of the tariffs and limitations on importing medical goods from overseas, especially China, have actually prevented us from getting things that work into our healthcare professionals, that they're either ordered destroyed, or they're stopped at the border, or they need to be smuggled in. And Dr. Everett, is it true that there are rapid tests available right now that would be able to determine whether or not somebody not only had the virus right now, but whether or not they had the antibodies from having had it, not had symptoms, and recovered, and would be safe to go back into the community and not be at risk of getting infected or infecting others?
Yes. So the company that Apollo mentioned in North Carolina, they make a 15-minute finger stick blood test. It's a serologic test. It looks for antibodies against the virus. There's two types of antibodies that we make against the virus. The first one we make is called type M, and the second one we make is called type G. So when you're fighting the virus, you're making type M, and as the fight goes on, M tapers down and G picks up, and when the fight is over, you're left with immunoglobulin type G, and the M goes away, and that's a marker of having had it and been done with it. So that's a 15-minute finger stick test. It has been available since, I think, January or maybe February, but not in this country, because of course it would have been illegal to use it.
So is that available now? Is that something the FDA
It is now available.
Now?
So I think 2 days ago, I think it was, maybe 3 days ago, the emergency use authorization was granted, so that it could be used by certified labs, but it's not a even though it's a very simple test to use, it's like a pregnancy test. It was still only released to certified labs.
So I just want to get this clear. Because of the federal government, a test that had been available for months, had been used successfully in South Korea to bend their curve till it's almost flat, was only approved for limited use in the United States, even though it's made in the United States, by the government 2 days ago when there were already over 400,000 cases around the world.
That is correct.
The company in Utah, when we contacted them and asked if they would be able to provide the tests, they were planning to defy the FDA regulations as well, and until they were unable to get the chemical compound needed to actually complete the test, the reagent that was needed to complete the test, until they were able to get their EUA, which is their emergency use authorization, which according to FDA officials can take 24 hours to get, and yet it's taken months for these people to receive their EUAs.
So, Dr. Everett, it's come up in one of the questions, but what are the reasons that we want to know who has already been infected with the coronavirus and has those type, is it G antibodies, the ones after the infection? Why is that important? Is that just important so we know who can go back to a bar or a restaurant? Or is there another reason why it would be helpful for getting through this pandemic?
Yes, so people who have recovered infections have blood that can actually be used to treat other people. This is a technique, it's more than 100 years old. It's called convalescent serum, convalescent being, the state of having recovered from an illness. And so it's being studied in New York City right now. New York City is recruiting people who have recovered from their COVID-19 illness to donate plasma from which these antibodies would be extracted. And a relatively small amount of plasma is needed to deliver an amount of antibody that can protect someone prophylactically. You need more to treat them, but the history of this technique, as I said, is very, very old. And in a pinch, until we have effective antivirals and further on, maybe a vaccine, it is a very good stopgap measure. And I would encourage anybody who has recovered from COVID-19 to donate plasma or donate blood. I would encourage anyone to donate blood because there's a big shortage right now. And but there's a clinical trial going on in New York right now, and we'll have the results of that very soon.
So one of the things that Apollo and other elected officials I've talked to around the country are asking, because their constituents are asking, is, what can their community members do to help? We're watching this happen, and everybody wants to look for the helpers, like Mr. Rogers says, in a crisis, and help the helpers and be effective in that. Dr. Everett, what ideas do you have as a healthcare professional for what communities can do and what elected officials like Apollo can do to show leadership in their community?
Well, there are some things that are a little bit less, more helpful and less helpful. Getting together in groups in a sewing circle to make cloth masks is probably not a great idea, because first of all, you're not isolating yourself, and cloth masks are actually, my hospital put out a memo today that, cloth masks are banned. They're not effective enough for this virus. People can donate blood. People can help the people who need help. They can check in on the elderly people. They can offer to care for the children of healthcare workers. The doctors and nurses in my hospital are under huge stress right now from the standpoint of childcare, because all the schools are closed, so no one's going to school. Everyone's at home, and when a doctor or a nurse or a respiratory therapist has to stay home to take care of a child rather than go in and save lives in the hospital. That's not a good allocation of resources. So, and some of the medical students at Boston University have stepped up and said, hey, we will look after your kids so that you can stay working. And that's a great thing.
Apollo, what other things are your members of your community doing to try and help out in this crisis and help each other and not wait for some sort of bailout or stimulus package or wait for the government to come help? What are they doing to model good libertarian values?
The first thing that we've been trying to do is to try to encourage social distancing through leading by example rather than trying to use mandates. So we have put together a 2-week social distancing friendly activity plan. We're going to be having yoga in the morning. We're going to be having bingo in the evening. We're turning our parking lot into a drive-in movie theater. We're doing a lot for the community to try to keep spirits up and also encourage social distancing as much as possible. We're continuing to map. We're asking our residents if you come into contact or find out you come into contact with COVID to reach out to us so that we can map on our own. And just today, I had a meeting with our friends at Rio Tinto, which is a corporation, a global corporation that has mining operations in our community, who will be donating 10 acres of land or a portion of 10 acres of land to be able to do a community garden or a community farm, so that we will allow our residents to be able to grow some food, of course, using social distancing guidelines and distancing and all of that. But we will be using that. That's our most recent one. We are focusing on empowering our first responders. We're focusing on empowering our residents to help themselves and their families. And we're trying to stay out of the way of the medical professionals and healthcare providers to make sure that they're able to provide the care that they need, and emphasizing as much as possible the importance of the social distancing. And I think that's what the role of municipal government is right now. It's not to give Class B misdemeanors to people who are out walking their dogs. It's not to shut down streets or to raid businesses with no-knock warrants because they decided that they're going to go make some bagels. That's not the role of our government at this time. The most important thing that we can do at this time is to empower medical professionals and keep our community members safe.
So, Apollo, there's a policy that we saw here in New Hampshire, and I know that other cities and municipalities around the country have had it, where a few years back there was a push to move to reusable bags, right? Because single-use bags are polluting and they get caught with wildlife and they have a lot of problems associated with them, and reusable bags seem more environmentally friendly. Dan just put up on the screen the very funny joke. We juxtaposed the union leader from here in New Hampshire, where back in January they banned all single-use bags in New Hampshire, and now here in March, because the virus can last on surfaces, they've now banned all reusable bags. My wife actually went to Trader Joe's the other day and brought in the bags we have for wine, and she was told to go back out to the car and put them away because they weren't allowed in the store. And the guy at the front of the store said, everybody's been doing it because we've trained for this other thing. Apollo, in a crisis like this, when we're dealing with an infectious pandemic that's changing how we ought to interact, is it your experience that government is moving fast enough, or that we just need to change things without waiting for government?
I think that we're seeing two extremes, and I think that you're seeing the successful communities are effectively removing the barriers that are required to combat this outbreak. Even down to Salt Lake County recently put a substrate in our playground because it was going to be more efficient. It could retain its color and it's more protective. It was safer to fall on. And now they're looking at it thinking, oh no, they believe that it might be material that retains coronavirus for multiple days at a time. So even down to the small details, it's pretty clear that some of the solutions the government have tried to prescribe in the past have only made this worse. And the two approaches are striking. You have cities that are trying to enforce these mandates that are locking homeless people in jail, which is which is causing outbreaks in prison environments, versus the communities that are we haven't needed to call any special meetings like our friends and our neighbors to decentralize, because we've already been decentralizing. We were able to shut down streets to just residents on a potentially infected area, because we had already removed the regulation that prevented that from happening at a quick pace. We were able to be much more efficient and much more nimble because we had already reduced those regulations, whereas places like Salt Lake City, Park City, who are putting much more draconian measures, are also the epicenter of our outbreak.
Dr. Everett, a lot of people right now are looking for either a governor or a president or even Dr. Fauci from NIH. They're looking to somebody to tell them what everybody ought to do, what the right choice is to deal with this pandemic. Is that the right thing for us to be doing, to be looking for one answer to these problems when we're dealing with an infectious disease?
Well, there are a few things that are common that we should all be doing in terms of the social distancing, the hand hygiene, don't touch your face. Certainly wear a mask in public if you're coughing. But to apply a one-size-fits-all solution to every community is clearly wrong. The solution for how New York City should behave is not the same as the solution for how Manchester, New Hampshire should behave. These are very different communities with very different issues. Rural communities are already pretty isolated. I think rural and semi-rural areas, all the people need there is just the right information, and they can take care of it.
And what I've seen from talking to doctors around the country and some around the world is that there are a lot of different ideas coming up, different antivirals, serum treatments, testing. There's a drug called Plaquenil, which the president talked about. The president made it sound like it was a silver bullet, which resulted in somebody using the wrong stuff in Arizona and killing themselves. But then the governor of Nevada decided to ban any use of Plaquenil for anybody. It seems like, and I'm not a doctor, but I'll ask you since you are, is it right to either say that this is a silver bullet or this is something that should be banned? What's the right path?
The right path is to let the doctors do their work. We're looking at hydroxychloroquine. There was some early data that it is somewhat helpful. It is certainly not a silver bullet, and it was, quite frankly, wrong for the president to put it in those terms. There's a couple of other retrovirals or antivirals that are promising. I wrote down the names here. I'm pretty optimistic about favipiravir, which is an antiviral that was approved in Japan in 2014 for the flu, but it has very broad activity, remdesivir. And they're going to be part of our exit strategy, because we can't be socially isolated forever. We need, once we quench the fire, once the fire break that we've put in place with all of this social isolation and enhanced hygiene stops the spread, well, we can't just leave our houses and go, and have it start up again. We need a plan. So that plan is going to be test and trace, test and trace, test and trace, like South Korea. We don't need to reinvent anything. South Korea and Taiwan know what to do because of their 2003 SARS experience, and in the case of South Korea, a very politically destabilizing 2015 MERS experience, where they learned some hard lessons there. And we need testing and tracing, and then more effective treatments. And once you have a situation where we've bought enough time that we have better treatments for the people who do get very sick, and we are testing and tracing the infections as they happen in real time with 15-minute or 1-hour tests, then we can put a lid on this.
So it sounds like really what we need to do is let a lot of different solutions be tried by different physicians, and then see what works, do more of that, see what doesn't work, do less of that.
Let 100 trials go forth, and let's see who has the best ideas, and then whoever does that, does the best, amplify that.
A couple of lightning round questions that have come in. If you know, and if you don't, I'm sure that you'll say you don't. Some people have heard that type A blood is an indicator of being more susceptible to this virus. Do you know anything about that?
I've not heard anything about type A blood increasing your susceptibility to viruses. It increases your susceptibility very slightly to blood clots relative to type O blood, but no, I'm not aware of any significant type A blood vulnerability.
Do you know if UV light, either sunlight or directed UV from a UV lamp, if that is known to kill a virus, or have you seen any research about whether a virus can live better in the dark or under UV light?
So UV, I don't know how much UV for how long is necessary, but UV light definitely kills these viruses. These viruses are actually pretty easy to kill. Direct sunlight for any period of time is going to kill the virus. A temperature of over 140 degrees Fahrenheit or 60 degrees Celsius for over 30 minutes, which is not that hot. That's cooler than most saunas. For 30 minutes, so you shouldn't stay in a sauna for half an hour. That kills it. It's not very heat stable, and of course, soap and water, demolishes the virus. Then alcohol demolishes the virus. So it's a outside of the transmission pathway, it doesn't last very long. On surfaces, though, it can last pretty long. On hard surfaces, the smooth surfaces, it can transmit disease for more than a day.
Last question, and it comes back to something. A lot of the countries that have flattened the curve have high use of masks by people in public, and our government has discouraged that. And you had talked earlier about how cloth masks are ineffective. When you say they're ineffective, does that mean that they're ineffective at stopping all viruses? Are they helpful if I don't know if I'm infected because I don't have symptoms, but it is infectious? If I go out and wear a mask, does that limit how many viral particles I might be putting out that could potentially infect other people?
Yeah, so the one, I think, legitimate use of a cloth mask, the homemade cloth mask, is that if you may be carrying the virus and you wear a cloth mask, you will definitely infect fewer people, hopefully no people. In a hospital environment where you are definitely running into infected people, the cloth mask is not adequate protection from getting infected. But in terms of from spreading infection, the cloth mask will definitely cut that down.
Okay, I think that's about all the time we have. We're about 3 minutes out. I want to thank both of you for taking the time out to help us build this sense of community as libertarians around the country and how we deal with this. I know, this affects a lot of things. It affects a lot of how we live our lives. And one of the things that we deal with as libertarians more so than other political parties is ballot access. We have to get petitions in a lot of states. And on an upcoming LPTV segment, we're going to talk about the public health implications of having petitioners go out and interact with the public with clipboards, what that would do for health and safety, and why we're trying to get relief from those requirements in this new environment. Even if those laws had made sense before, like the reusable bag bans, maybe they don't make sense right now if we want to be all in this together against an infectious pandemic and a virus that is trying to kill us and kill our loved ones. I think you guys have provided some really great information. I'm sorry we couldn't get to everybody's question. We had a lot of comments from the viewers. I know they appreciate it. This will be up online and you can share it out. If you see those comments online and you have answers, please feel free and put them in. Thank you so much for your time. Thank you for joining us tonight. Thank you for everyone who watched. Go out there, give blood if you're able to. Wear a mask or a bandana if you're able to. Show people who libertarians are and what we do to try and protect each other, protect ourselves, and protect our communities. And we'll get through this together. And I think a lot of people will be watching to see how we behave and how we exercise our freedom and disobey those laws that would stop us from saving a life but we also follow good scientific and medical advice to show that we don't need government to tell us to be good to ourselves and good to each other. So with that, thank you all so much for joining us tonight on LPTV. Thank you, Dr. Everett. Thank you, Apollo Pazell. Have a great night. Be safe.
My pleasure. Thanks, Nick. Good night.